recurrent respiratory papillomatosis is a challenging disease and a very rare disease that is very difficult to manage. Patients usually come in with symptoms. They require repeated surgical interventions. There has been no approved treatments, systemic therapies for this disease until very recently, with an approval of a DNA-based therapy. And this presentation at ESMO is for another DNA-based therapy, which is from INO-3107. This is a DNA-based vaccine that is targeting HPV-6 and 11, which are the two basically viruses that cause recurrent respiratory papillomatosis. And so what's been observed with these interventions is that the chance of needing surgical intervention after the treatment decreases significantly for patients. And we've observed a decline that basically was accentuated in the second year. So when patients got this treatment, essentially they required less and less surgeries in the second year. And that reached about 50% or 50 to 60%. And then in the second year, it reached about 80%, which indicates that the treatment itself is inducing an immune mechanism, hopefully, to abrogate the recurrences of these tumors. This is not considered a cancer, but it is a virally mediated condition. And it somewhat falls under the head and neck premise because we deal with different virus-mediated tumors. And HPV-16 and 18, for example, are precursors for oropharynx squamous cell carcinoma and other malignancies. And studying RRP, recurrent respiratory papillomatosis, really would be I think, enable us to understand how these virally mediated tumors develop and how to tackle them. And so I think the results of INO-3107 that we're presenting are very encouraging, heading us in the direction of improving the outcome for these patients, hopefully over long term, and hopefully allowing us also to decipher the immune-based mechanisms that could help these patients long term.